So what a crown is, the way that I normally explain it to patient, is almost like a ball cap. It's just meant to cover a tooth that's been badly damaged, so we can protect it, and it would most likely last that patient at least, I say 15, 20, and I've seen some that are 30 or 40 years old. A bridge is, I guess you can call them crowns that are linked together. And the purpose of a bridge will be to maintain the integrity of a space that has been created from extraction. So a bridge maintains that space and at the same time gives the patient something functional to chew with. There's several reasons why a person may need a crown. Let's say you have a lot of decay on that same tooth, okay? When it's badly damaged enough to where over 50% of that tooth is gone, we normally would recommend a crown for that particular tooth. So decay, that's all over the tooth. Another reason why a patient may need a crown is of fractures, because of fractures, okay? Fractures, we can generally see those in the mouth. X-rays, it's hard for X-ray to capture a fracture, okay? So we don't know the depth or how deep it goes. So anytime we see a fracture, we always recommend that patient to get a crown as well. We normally would recommend a crown for every patient that had a root canal, just to protect that tooth a little further. Since now the tooth is weaker, the crown would actually help it be a little stronger and last a longer time. For the experienced, they come in, we take a mold, we get them numbed up for the procedure. We then make a preparation on that tooth for the crown, to receive the crown. We then put a temporary on that tooth, okay? We send the patient home, and then we take the impression that we've taken, we send that to lab. Lab fabricates the crown for us, and they send it back to us, and then we bring the patient back. When we get it back from the lab, we always double check to make sure that the shades are somewhat the same, and that's when we put the permanent crown. We permanently cement that crown to the tooth. So a lot of patients will come into the office and they always question if crowns are painful. They're not. We normally would just let them know that it's just a little bit of a longer appointment. It's usually a pretty painless appointment and procedure. If you are interested in a crown, or you feel like you need a crown or bridge, you definitely should contact your dentist and have a consultation with them, and they should be able to walk you through and tell you exactly what it is that you need.